Welcome to the University of Wisconsin-Stevens Point Fish Health Dissection modules. The dissections and fish health examinations are performed by fish veterinarian Dr. Myron Kebis. These dissection modules were filmed as part of a fish health workshop, an event hosted by the Great Lakes Aquaculture Collaborative. Arctic char were provided for this workshop, donated by the University of Wisconsin-Stevens Point Northern Aquaculture Demonstration Facility. These fish were graded out of a larger population as the smallest fish and humanely euthanized for this workshop. The char were hatched at the facility and raised indoors in circular tanks and fed a commercial aquaculture diet. During this first module, you will learn how to examine the external anatomy for fish health.
And the total length is going to be a measurement all the way from the tip of the rostrum to the tip of the tail. And that's really important because once let's say we get I'm going to say there's 20 of us here just for convenience, 20 of these fish, then you can get an average. And you can also get an idea how much of variation there is. We can, in looking at this group, I think we're going to see some variation. And that kind of variation is one of the first steps in kind of getting an idea of, do we want to change the way we're raising the fish? Or is it something related to genetics? Or do we want to be looking at the nutrition? Now the other part of it, of course, is weighing the fish. And then with those two combined, you can get what's called a condition factor. And there's a formula to plug those numbers in, and it gives you an idea of the general body condition. So if you have a long fish at low weight, it's going to have a lower condition factor. Those are the measurement things. From a visual standpoint, one of the first things is to look your fish straight in the eye. And take your fish and look at it in the eye, and you're not really looking at the eye, but you're looking at the epaxial muscles, or the back muscles. And this is your first indication of the plane of nutrition that the fish are on. So in this case, what I'm seeing is the epaxial muscles are relatively curved like that. Now, you will run into fish in situations where it might be straight, which means that it's beginning to get undernourished. And when they're starving, it's going to curve. It's going to dish down. So that gives us the first indication of the plane of nutrition. Then we focus in on the major organs. One is the eyes. Look at the eyes. The kind of things we might see in the eyes are exophthalmia or pop-eye. We may see sunken eyes. We may see redness associated with the eye. These appear relatively normal. Though, if I look at the eyes on this fish, and I do see that the right one is more curved out, and the left one is flat. Now, as we do this, we kind of got to separate between a couple different things. One thing, look at your fish, because like on this side, you're going to see a light coloration. And this side, the normal coloration. What does that tell you about the way the fish was probably lying? It was probably lying this way. So with its left side down, that's why the left eye is flat and the right eye has a more normal curvature. In some cases, you'll see the eyes bulging on it. With trout or walleye or in recirculating systems, you might see that due to gas supersaturation. Gas might be oxygen. The gas might be nitrogen. If you have a cold water hatchery, it's probably more common to see in the spring. In a recirculating system, it might be associated with a fitting of the plumbing being hit and causing a Venturi effect, sucking in air. But we look at the eyes. Also, the eyes kind of give us an idea if we have a infection, bacterial or viral condition going on. When you're talking to other people on your farm, or you're talking to a veterinarian, or you're talking to Dr. Locke or Dr. Phelps, don't worry about the veterinary pathology terms. just focus in on terms that could be readily explained to anyone in your family. In terms of this lesion here, this is more of a traumatic nature than of infectious. This fish is quite interesting in terms of the mouth. I'm going to see, what would be some of the words you might use to describe the mouth on this fish? I'd start with red. It seems to have some redness associated with the mouth here. It also has an interesting shape that I'd have to look at a number of them, but sometimes you can have. It's kind of got a short, for a salmonid, it's got a short snout, and that can be due to genetics. Some of the strains there, and some of it could be due to early on altering of the upper jaw or the lower jaw from running into the tank a bit. But this hasn't impaired the fish from eating, obviously. If you look on these, a lot of times what you'll see, if they run into the tank, they'll be calloused, the skin will be gone on the tip. I'm not necessarily seeing that on my two fish. I'm gonna put maybe running into the tanks even lower on the list now, and maybe genetics remains kind of a little bit higher on the list. So very interesting there. So as we continue on this, one of the most important things to look at is the gills, and we're gonna look at that in a minute here. But I want to finish with the external. So part of it is looking at the skin. Now, here's an interesting example on these fish. This fish doesn't show many spots, and this fish shows a area that's bluer than normal. And again, are these things that occurred before or after the fish died? Here, if I flip this fish over, this is a more normal coloration for these fish. So if we look at the skin of these fish, there we're looking for any kind of ulcers, any red areas. I'm not so much seeing it on either side of these two fish. I'm not seeing anything on the other side of these fish. So I think before they were euthanized, the skin was quite good. Let's look at the fins. And here, you want to do it systematically. So I like to start with the pectoral fins, and I'm just going to do one side, and then we'll look at the other side. So this is the left pectoral of these fish, and I'm going to describe that there's fray, and there's an erosion on the tip. And if you were to grade this, it would be slight, to moderate there. Then on the pelvic, I would say there's no real significant erosion or a little bit of malformation on there. Then look at the anal fins on your fish. Not too bad. But tell me if you're seeing anything. The most remarkable thing I'm seeing is on the tails. So this is significant erosion. So what are some of the things you might think about when you see this on your fish? What might be causing this kind of erosion on the tail?
Other fish nipping it.
Other fish nipping it? Yep. So
Hitting like the sidewall, I guess, like brushing against those.
Maybe trauma against other things. Yep. There's another thing you might think about too, and that is from a nutritional standpoint, if we have a nutritional deficiency, we can see more skin or fin erosions. I don't know that I can necessarily attribute that to this group. Based on the history, I would ask the farmer, when we developed the health assessment, we used it on trout farms, and what we would find is that when you had a spread of groups, most significant erosion in the fastest growing, biggest fish. And part of it is they're always working to get food, and they're carrying out that trauma that's going on to, a lot of times their dorsal fins are rough shape, but they're big fish. They can keep on going. And look at the dorsal fins on yours. This smaller one, I would say, has slight erosion, and the larger one looks less so. So there you can see these differences. We also want to look at both sides of the pelvic and the pectorals. Take your surgical scissors and take your forceps and lift up the operculum or the gill flap and cut off as much as you can to expose the gills. The gills are perhaps the most important. It really gives you a window into the health of the fish. Now, as you know, the appearance and cellular nature of the gills will change very rapidly after the fish dies. What I'm going to focus in on is looking here on the different hemiarches here to see, first of all, the general color. And the general color on these is red, and it's dark red. And the same thing for the smaller fish here. But I'm looking for any kind of abnormality. Sometimes in your fish, you may see grayness along the margins of the lamellae or the branches that are coming up. That grayness can be a sign of water quality problems, of suspended solids in the tank. It's one of the signs of gill disease. And there's a number of different diseases that affect the gills. Some of them are bacterial nature, some of them parasitic. And one of the things that you would do if we're going to do a microscopic exam is you could get a snip of the gills like this, and even a small portion like that, put on a cover slip on it, and a slide will allow you to visualize and pick up a lot of significant pathogens. A lot of the things that we can diagnose can readily be done with using the techniques we're doing today in a light microscope. And a lot of problems you're going to run into, whether it's rainbow trout or walleye or yellow perch on your farm, are going to be either related to bacterial infections associated with flavobacteria, which causes conditions such as columnaris or cold water disease in trout. And then the other big group are the ectoparasites, and those are readily available with a light microscope. But looking at your gills now, I just want you to take a look at them visually. And do you see anything? Are they dark? Are they pale? Are they a little bit of dark and a little bit of pale? So to me, these tell me that these fish were probably exposed to very good water quality throughout their growing time. As you probably know, the gills will deteriorate quickly. Also, the fact that the gills are still good condition tells us that the fish in general is going to be good for examining because it has been maintained at a good temperature and there isn't a lot. What breaks down the most are the gills. So if you get the gills and they're already starting to appear mushy, pale, you know that fish has been sitting there a long time. And that's what will happen when you have fish that have died and that are staying in your water. Which, by the way, I have to use the opportunity to say, whenever you see a dead fish, take it out. And the reason you want to do that is because what we know with so many of the pathogens, that fish is not done creating problems for you. You've already lost that fish, you've lost all the food, all the labor that went into it. But dead fish then are a tremendous source of releasing bacterial, parasitic, other pathogens. So the quicker you get that out, the more you're going to reduce the chance of those organisms affecting your healthy fish. So now we've looked at the major external, and we can begin to say something about these fish. And I'm going to just give you a kind of summary, and I would say that for one, there's size variation in this group, but not necessarily body condition variation. Here's a smaller, but both of them, their apaxial muscles are in good shape. Some of that variation may be due to genetics. It's not necessarily due solely to differential in terms of feed. I think one of the interesting things to note again is the head on these fish, and this wouldn't be an issue if you're selling a filleted product. It could be an issue if it got more severe in terms of reducing the ability of these fish to efficiently feed and grow. In terms of the skin, I'm not seeing any significant abnormalities, which is a really good indication that they've been handled well. Skin lesions, a lot of times they're going to be initiated from netting or crowding in ways that can damage the skin. And as far as the fins, in a intensive situation, you're going to see what we're seeing, particularly on the tails and so forth. That's somewhat to be expected in a high density rearing situation.